Hello everyone, welcome back to my channel. My name is Julie and this channel focuses on makeup, mental health, and music. Now that I've made a couple of makeup videos, I've been waiting to make this mental health video for a while now. So if I'm looking down, I just have notes and perhaps I will cut some of this out. I did a kind of like off-the-cuff version of this video and I thought it was pretty good and well-informed, but after I edited it, I felt like I just wanted to do this topic justice because it's really important to me. So this is a video on specifically trauma-informed care and how it's time for it to take over. There are a few reasons for this, one of them being that we are in a public health crisis with how traumatized people are. It's mostly specific to children because there's an extensive amount of childhood trauma and it's affecting children mentally, physically, developmentally, etc. because all of those things are interrelated, and our mental health obviously affects our cognition as well as our physical health. So in my grad program, again, I'm studying for my master's in counseling psychology. We watched a really cool documentary called Paper Tigers. It was the first documentary, I believe, of its kind that focused on an alternative high school where they first implemented trauma-informed care. So one of the main things that I learned from this documentary, and this is a really hard concept to grasp, I think, because it's controversial and we're shifting from kind of like a psychoanalytic behavioral approach to humanistic / trauma-informed. So the main lesson was the behavior is a symptom, because obviously in an alternative high school, the kids are going to be classified as behavioral. I feel we need to get rid of that term and stop calling it that. The people in the documentary did not call it that whatsoever. Another important lesson from the video was that it is ethically okay to tell your students that you love them. I feel like this is easier for teachers and staff that aren't mental health related because there's a lot of ethics involved both for school adjustment counselors and licensed mental health counselors or social workers. But at the same time, if you have that relationship with a student or client and perhaps they said it first, or you show that you love them only platonically, I feel like it's appropriate as long as it doesn't go too far. When I worked in kindergarten, I got weird looks all the time because I told my students I loved them and they told me they loved me, and I feel like a lot of them didn't get that love at home in certain things and needed a little extra TLC in a school setting, and I think that's okay. I don't really care about anyone's weird looks because I felt like it was the right thing to do, and I stand by that decision professionally to this day. I have one student, and again, I cannot get into details on cases with students to protect confidentiality and their privacy and whatnot, but him specifically, I will tell him that I love him in a platonic way because my colleague does as well, and I just feel like with his background and struggles and things that it is what he needs. There are other students I don't have as much of a relationship with and I would never do something to make them uncomfortable. I do have one student who told me he loved me, like when we were hanging out one time, and I said, I love you too, platonically, of course. So it was funny, but I just think that that's important, and that as a clinician, you should be another positive, supportive person in someone's life, and it shouldn't, your job should not just be, oh, I talk to you and help you for 45 minutes. You should be doing research outside of that, and you should be showing the client you care. And that's where trauma-informed care comes in. The Paper Tigers documentary, it was really interesting because the school staff, if a student didn't show up to school, they would actually go to their house looking for them. There was a teacher who took in a student and adopted them. She adopted a student because their upbringing was not good. And in my program, there are a few teachers going for counseling, and they said it happens more often than you'd think. I think there's probably ethics involved with counseling where we can't do it, but I'm appreciative that a teacher did. Another thing they did in the documentary was took students to tour colleges, which ethically I don't think in a public school or as a therapist we can do, but I just appreciated that they really were ultimately involved in these kids' lives as much as possible and did everything they could for them, because to me that's trauma-informed care. When students in the documentary lashed out at school staff, instead of school staff reacting and reaching that heightened state the student was in, the staff expressed to them that it was hurtful and recognized it was a trauma response. Students tended to be receptive to this care and actually tended to apologize to their teachers because they had a good relationship with them. And again, the relationship's the most important thing, which I will get into later on. Students in the documentary at this alternative high school took the ACE test. I will talk more about what this test is further on in the video. However, if you have a score higher than 4, it puts you at risk of physical health issues, 20 years less of life expectancy, suicidality, as well as criminality, and you're at risk of repeating the vicious cycle and becoming abusive toward your own family one day and causing them to be more likely to go on and repeat the same patterns, which is really sad. So the point of taking this test was to show students who are at risk, which I'm sure many of them were in this setting, that they need to break the cycle for prevention for themselves and for their families one day. Back to ACE. ACE stands for Adverse Childhood Experiences. It currently encompasses, from what I know, 10 specific childhood traumas that can occur. And if you have more than 4, it puts you at risk for a lot of things. There are wonderful videos on this. Another thing with trauma is there's a big misconception that these like absolutely horrific things need to happen to you that anyone would consider a trauma, but this can be very invalidating. I don't even like the term micro traumas. I think that all trauma is valid. So the next topic I'd like to focus on within trauma-informed care is psychoeducation on trauma. Psychoeducation is exactly what it sounds like. It's education on psychological topics, helping people to improve their well-being and awareness of mental health and things of that nature. Trauma in childhood specifically impacts development, social-emotional well-being, and physical health. So it's kind of like the biopsychosocial model, which if you ever study psych, you'll learn about. And it's, again, exactly like it sounds. Biology, psychology, and social aspects are all interrelated and affect each other. Trauma-informed care is a wave that I feel has come from complex PTSD, which isn't in the DSM-5 yet, which is what we use to diagnose in the US for mental health issues. However, it is in the ICD-11, so it should be coming along in the next version, and it is recognized by a lot of clinicians, especially trauma specialists. And I can make a whole video on this as well, but there are separate symptoms to complex PTSD, and there are a lot of behavioral symptoms to it as well. So trauma is very personal. It's up to the client's perception. So for example, say someone technically wasn't bullied in school. Maybe they just have trouble navigating social situations. But if they perceived it that way and it affected them that way, it's valid. We may not, as clinicians, say, oh yeah, you were bullied, but we can identify, yeah, it sounds like you feel like you were bullied and that really affected you. There's a discrepancy on trauma that the worst possible incidents need to happen. Most people, when they think of PTSD, think of being in the war or being brutally hurt in some way. So I made a list of other traumas, and please, if you know of any more, or you've experienced any more, or you want to educate our followers on this, that would be wonderful, because I have a list here, and these are just the ones I could think of off the top of my head, and I guarantee there's so many more because trauma is so unique and personal. So I listed divorce, emotional abuse, because we always think of physical abuse, but we don't recognize sometimes how much emotional abuse can impact someone, especially a child. Neglect as well, bullying, and I'd have to pull up the facts. I believe I read through an article that about 33% of children are bullied in school at this point, which points to a crisis. And I wrote a paper for my crisis intervention class on bullying and bullying prevention, and I am glad that after all these years, it's finally considered to be a crisis, because it is. It puts students, children at risk of so many different things, and we need to protect their well-being, of course. So back on this. Oppression and racism, huge one, absolutely affects people. Homophobia as well as transphobia. Phobia of any kind against your identity or personal values absolutely counts. So discrimination of any kind, breakups and friendships ending. Maybe not every single one, but if it affected someone in that way, say you had a friendship or a breakup end, and maybe it takes you on average like a couple months to recover. However, it may take you longer, or you may hold on to anger and pain for years, and you may be ruminating or having flashes of memories that hurt or were unpleasant. And to me, that falls under a trauma. I really think that it should be acknowledged. Also, it's important to mention that just because someone has a trauma history doesn't always mean that they'll end up having PTSD or a mental health issue, although it's very possible, and I feel that trauma affects all of us in certain ways, whether we have a mental illness or not. Comparing traumas, gotta go. It's gotta go. It invalidates the experiences of others. It's unacceptable, and it absolutely does not fall under trauma-informed care whatsoever. People need to be trauma-informed, in my opinion, and be able to support their loved ones. However, they need to also take care of themselves and set boundaries. Yes, setting boundaries is part of self-care, and they have to care for their own mental health. Absolutely. And secondhand trauma is a thing. If you're dealing with a child or a loved one who has mental health struggles, that absolutely can traumatize you as well, or just affect you mentally in some way. Other common diagnoses that trauma can lead to are borderline personality disorder, bipolar disorder, depression, anxiety, OCD, and phobias, even social anxiety. Trauma in kids can often be misdiagnosed as ADHD because it comes out in so many behavioral ways, and they can appear to be hyperactive and impulsive. But it's important to differentiate, do they have a trauma history? Is this trauma related, or is this an actual neurological issue? Because ADHD is not a mental health issue, although it affects mental health. As I said, there's a behavioral component within PTSD, especially for kids. So back to my point from earlier about labeling kids as behavioral with externalizing issues is just really outdated and hurtful, in my opinion, because any kid with externalizing issues has internalizing issues as well. And that needs to be acknowledged for sure. However, it is important to validate the frustrations of helping professionals, because behaviors can be difficult and stressful to deal with, especially I would say for school counselors and especially teachers, because teachers are responsible for everything, right? I have a high respect for teachers. I was in a teacher type role for 7 years. My mom's been a teacher for many, many years, and I see the hard work they have to put in. And now they're expected to care for social emotional well-being and academics, which managing the behaviors of 20 kids in a classroom is basically an impossible task to accomplish, in my opinion. However, I do feel the mental health of students is obviously important, because if the mental health isn't in a good spot for some, their academic performance is going to be poor. So I feel teachers should help with that, but at the same time, school adjustment and other counselors should be involved to take some of the weight off teachers. There also should be a lot of collaboration as well. Another thing I want to touch on is burnout, because when working with traumatized kids or people, burnout can be really high. So warning signs of this may be compassion fatigue, snapping, yelling, complaining, perseverating, anxiety, or stress. So look out for these, and if you feel you're experiencing these, I hope that you have some access to mental health care. If you do not, I plan to put a lot of free self-help resources on this channel, because the fact that we have to pay for our mental health care makes no moral sense to me whatsoever. So if I can help with that in any way, I absolutely will. I encourage all helping professionals, including teachers, to take continuing education courses on trauma-informed care. My mom's been doing that recently, and it's been really helpful for her. So definitely consider it if you're open. This section is trauma-informed care, specifically for therapists as well as school counselors. One of the most important pieces of trauma-informed care is validation. So validating the feelings of your client or student, no matter how small the problem may seem to you, which is why I kind of struggle working with other populations that their treatment's more behavioral based, because I just feel that intense feelings should always be validated, because, you know, kids are really struggling with that. So I'll give you a few examples I could think of validating responses, and I would love to make a video just on validation. I think that'd be really cool. It's something for me just comes very naturally, whereas others have to work on it, but I'm totally cool with that. So here's a few examples. That wasn't fair to you. Looking at themes of what happened to kids. A lot of the times they're going to feel like they experienced an injustice, and they may not use those terms, but if they're frustrated by something that happened, you can say, that wasn't fair to you. This can be abandonment, loss, being betrayed or taken advantage of, or simply just having their feelings hurt, right? So as I said previously, we're shifting from psychoanalytic perspectives, although they're valid and I love using them and sprinkling them in. At the hub, we really need to be trauma-informed / humanistic and person-centered. So back to validating statements. You are allowed to be heard. You are entitled to your feelings and your pain. You are valid. And I like to validate teens in a funny way, just being like, that sucks, or like, oof. It's really simple and it works, and I don't know. I do that with my friends potentially, so I guess I enjoy that. Back to psychoanalysis shift. For years, we've been working with clients and saying, okay, what's wrong with you? We need to go shift from that to what happened to you. Because a lot of kids and adults, when they are traumatized, are in the victim stage of trauma. And we'll get into stages in a bit. It's important to acknowledge the client was a victim in certain situations, but they deserve to become a survivor and eventual thriver. From what I've learned, there are 3 phases in the healing recovery of trauma. So we start with victim and then survivor and then thriver. But obviously this process is in depth and can take time because trauma can be so deep and complex. Another thing I strongly believe in, where applicable, is the egalitarian therapeutic relationship or alliance. With ethics in mind and respecting yourself, allowing the client to have control in counseling is helpful, but only where applicable, because obviously you need to stay safe, obviously you need to be respected, and obviously there are some things in your role that differ from theirs. I just don't believe in a power dynamic existing between therapist and client, because I think it makes the client feel uncomfortable and it's also kind of dehumanizing. I believe in therapists being authentic, real, and genuine, although those may be synonyms. They're at the hub of trauma-informed care as well. Self-disclosure is, obviously you have to be very delicate with this and ethical. Only use it when you think it's helpful, never to go on about yourself. But I think that self-disclosure, showing you're a real person who's been through things and you came out on the other side, and you may be successful or seem successful to your client, but acknowledging that you still have things to work on, talking about that you're in therapy, which I do. I don't go into detail. I just say, hey, I'm going to therapy. I have therapy today. Therapy is awesome, because the stigma of that, it's gotta go. It's gotta go. Relationship building. If you take away anything from this video, take away this. Relationship building. Relationships are the most important part of counseling. They are the most important part, in my opinion, in any helping profession. A lot of people ask, and I've asked my supervisor this, how do you de-escalate a child when they're up here and they're having a hard time? Because if they don't know you, it's going to be way worse. But if they know you and they trust you, you can bring them down solely from your relationship and being there for them, which is really powerful stuff. I think communication in therapy is so important, communicating with clients about what their needs are in therapy and letting them lead the sessions while asking clarifying questions and validating. Clarifying questions are an important part of trauma-informed care as well. You want to make sure that you fully understand what someone is talking about and not just assume that you do. From what I've read, and I want to take way more classes in this eventually when I'm licensed, is that LGBTQ plus clients require even more nurturing and counseling than trauma-informed care has to offer within the humanistic or person-centered approach, which I just think needs to be taken into consideration more. Onto these fancy terms I've used, where if you're not in a helping profession or counseling, you're probably have no idea what I'm talking about. So I'm going to try to go through this and see if clearing it up is helpful. So the person-centered or humanistic approach to counseling comes from a psychologist named Carl Rogers. It's a strengths-based form of counseling, so focusing on client strengths and using those toward their coping skills and processing and healing and recovery. Validation is at the forefront. Empathy, of course, being genuine, real, and authentic. Self-disclosing when appropriate or helpful. Helping clients to work toward finding their identity through self-actualization, which is a process and takes time. Recognition of feelings and expression of feelings. Present moment experiencing, which can be really hard if you have a trauma history, but it's something to work on. Goal setting is great, and goal setting entails having a sense of agency, being your own advocate. peak experience and flow. So that kind of pertains to doing an activity that you enjoy, that makes you feel happy, and just kind of getting lost in the activity and not thinking about anything else. Obviously, we can't control that, but when we have something we enjoy, positive psychology has taught us that it's possible to just kind of get lost in it, and I think that's a really powerful thing. The interventions specific to this form of counseling are process questions, self of the counselor, so again, focusing on talking about yourself with ethical boundaries, of course. Summarizing, so summarizing back to the client what they told you to make sure that you fully understand, as well as shortening it, getting rid of extraneous details and just identifying the specific themes of what is hurting the client, what is happening to the client, etc. Clarifying, as I previously said, can be helpful, as well as reflecting feelings, like saying to your client, instead of, how does that make you feel? You seem like you're angry. Is that right? You seem frustrated. So I hope you enjoyed this video. Feel free to like and subscribe if you want. Leave a comment as long as it comes from a kind place. And I hope this was informative and helpful. Catch you on the flip side. Bye.